This is my head and neck assessment.
Come in.
Hi, good morning. I'm Heather. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
Tierra White, 9/11/95.
Okay. Are you allergic to anything?
No, ma'am.
Okay. And what brought you in to see the doctor today?
Just an annual checkup.
Okay. Any pain today?
No, ma'am.
Okay. So what I'm going to be doing before the doctor comes in, I'm going to be performing a head and neck assessment on you. And what that involves is I'm going to be feeling your scalp. I'm just checking for any lumps, bumps, or bruises. Have you ever had a head injury?
No, ma'am.
Okay. Are you having any headaches?
No, ma'am.
Okay. And then I'm going to be checking your eyes. I'm going to be checking your vision and just make sure that your eyes look healthy. Make sure that your pupils constrict and dilate. Have you had any eye pain, any blurred vision, any drainage?
No, ma'am.
Okay. I'm also going to be checking your ears. Do you wear hearing aids? Okay. Have you had any loss of your hearing?
No, ma'am.
Okay. And any ear pain or drainage?
No.
Okay. And do you wear glasses?
No, ma'am.
Okay. I'm also going to be checking your nose. Have you had any sinus pain or congestion or drainage?
No.
Okay. And I will be checking your mouth. Have you had any tooth pain, any trouble chewing?
No.
Okay. Are you eating adequately? How many meals a day are you eating?
3 meals.
Okay. And do you have any concerns about where your next meal is going to come from?
No, ma'am.
Okay. All right. And can you tell me your weight?
157.
Okay. And how tall are you?
4'11".
4'11". Okay. And then also when I'm doing this, I'm going to be checking your neck. Have you had any neck pain, any swelling, any pain when you turn your head, anything like
No,
that?
ma'am.
Okay. Okay. So I'm going to go ahead and get your vital signs. Put your baby there. Thank you. Okay, your oxygen saturation is 100. Okay, now I'm going to check your pulse. I'll just do it over here. Thank you. Okay, good. Your pulse is 80. And your respiration is 18. I'm going to get your temperature. I'll just have you hold this under your tongue for me. Okay, 97.6. Thank you. And now I'm just going to bring a chair over. And I'm going to get your blood pressure. Thank you. Okay, your blood pressure is 122/76. Now I'm going to go ahead and feel your scalp. And you just let me know if you have any pain or tenderness.
Okay.
you open and close your mouth for me? Any pain or tenderness with that?
Mm-mm.
Okay. While I have my gloves on, I'm gonna go ahead and just check your eyes. I'm gonna pull down just slightly. Okay, good. And I'm gonna just feel your sinuses. You let me know if you feel any pain. Is that good?
Mm-hmm.
Okay. All right. Let me take my gloves off. All right. Now I'm going to check your vision. And you said you wear glasses or no? Okay. All right. When was the last time you had your vision checked?
6 months ago.
Okay. And no problems?
Mhm.
Okay. And what I'm going to have you do is just look over at the wall. Can you read that sign on the wall for me?
Call before you fall.
Okay. And can you read a word on there?
Demo dose.
Okay, perfect. Now, I'm going to hold my pen light right here. I'm going to have you look over my left shoulder at the wall.
Okay.
Okay, so go ahead and look. And there we go. Okay. And now, I'm going to have you look at me. And I'm going to bring my finger in. You just let me know when you can see it, okay?
Okay.
And the other.
Okay.
Okay. And now I'm going to hold my pen light out. I want you to just follow it with your eyes and not your head, okay?
Okay.
Okay, now I'm going to shine my pen light in your eyes, and that's just checking to make sure your pupils dilate and constrict like they should, okay? I'm gonna just have you look again over my shoulder. Okay, that looked good. And I'm just have you look at my pen light and just follow it. Perfect. All right. Now I'm going to go ahead and move to your ears. And you just let me know if you feel any pain or tenderness, okay?
Okay.
And I don't note any drainage. I'm going to take a look at your other ear.
Okay.
And now I'm going to do a whisper test on you, and that I'm going to have you cover your left ear to start. And I'm going to whisper a series of letters or numbers, and you just tell me if you can hear it. You just repeat it back to me, okay?
Okay.
3,
3, 4,
6.
6,
Okay, and now the other ear. Okay. 7.
7,
Dog.
dog, 3.
Perfect. All right. And now I'm going to take a look in your nose.
Okay.
What I'm going to do first, I'm going to have you close one side of your nostril and breathe in and out for me. Okay, good. And now the other. Okay, and now I'm going to look inside. And so just look up. Have you had any nasal pain or drainage?
No.
Okay, all right. And now I'm going to look in your mouth. If I can just have you open your mouth for me. Okay, say ah. Any loose teeth or any tooth pain when you chew? Okay, go ahead and stick your tongue out for me and wiggle it around. Okay, good. And now I'm going to feel your neck. I'm checking for any swollen or tender lymph nodes. So just let me know if you have any pain or tenderness. Okay. Okay, and now I'm just going to feel your pulses. I'm going to have you look over that way for me. Okay, those veins look good. And this way. Okay, good. And now I'm going to have you push against my shoulders. Okay, And I'm gonna have you look up for me and down. Look that way and this way. And just kind of roll it around. Any pain with that?
No.
Okay. And any other concerns you have today?
No.
Okay. Let me see if there's anything that I forgot to ask you about today. No, it looks like we're good. So you have everything you need. Your call light's right there. The doctor will be in just a few minutes, okay? Thank you so much, Ms.
Thank
White.
you.
Have a good day. Okay, my patient came in for her yearly assessment. She doesn't wear glasses, contacts, hearing aids, or dentures. She has no complaint of pain. She's never had a head injury. She's not allergic to any medications. Her mood and affect are appropriate. Her skin color, her skin is warm. The color is appropriate for her ethnicity. Weight is appropriate for her height. She doesn't have any nutrition concerns or where her next meal is going to come from. There was no lumps or lesions on her scalp, no drainage from her eyes or her nose, no swollen lymph nodes, no problem with her neck, no pain. Her vital signs were all within normal range. She's not allergic to any medications or anything else, and she doesn't have any concerns today, and so she's ready to see the doctor. Thank you.